Hey guys, welcome to another Live at 5 with Valencia Medical Center. I'm Dr. Abraham, and today we're going to be talking mainly about hormone replacement therapy, specifically about pellets. Um, so I know you guys have sent us some questions before. If any other questions pop up during the today's live, we can also get to them. But we're basically going to be talking about hormone replacement therapy, and we're mainly going to be talking about the testosterone, estrogen, and progesterone triad, both for males and females. We usually, most of our clients are in their 40s, 50s, 60s, and even 70s. So that's kind of the main clientele that we treat with pellet therapy. But we're going to be diving in a little bit deeper on pellet therapy, what it is, and some of the questions that you guys send us. So I know you have the
Yes.
first question.
Why do women need hormones before, during, and after menopause?
So why do women need hormones before, during, and after menopause? Well, uh, hormones regulate many of our body functions, and they're associated with so many things that we do. They help regulate, generally speaking, hormones regulate our sleep, our energy, our just body functions in general. They help with our metabolism, and so with in the female with the cycle, there's obviously the whole kind of issue of reproduction where hormones are very important in regulating. So hormones affect almost every function or so many functions in the human body, and whether it's women or men that we're talking about. Before premenopause, so with women we kind of tend to divide it as premenopause, perimenopause, and postmenopause, just because premenopause, the woman's ovaries are helping regulate the estrogen production. With the whole, the estrogen, LH, FSH, progesterone, all these hormones that we are associated with the woman menstrual cycle, they kind of have a very regulated rhythm that plays a role in the woman's function. But after menopause, well, perimenopause is the area where that kind of rhythm gets dysregulated, and postmenopause, what we see is that there's a significant drop in estrogen and a rise in the FSH, which kind of works opposite of the estrogen in terms of the levels in the bloodstream. So after menopause, the ovaries aren't doing their jobs, regulating the cycle as they used to, so the estrogen levels tend to drop. Around the same time, the testosterone, drops with age. So people in their 30s, even they start to see a drop in the testosterone, and that's for both males and females. And then in the 40s and 50s, the testosterone continues to drop. So a lot of times, when women specifically at a certain age after menopause, the testosterone has been declining, and that now all of a sudden the regulation of estrogen is disrupted, and then you see a drop in both estrogen and testosterone, and a lot of symptoms will start to appear. The estrogen is not as much of an issue for males, but they do have the same pattern with testosterone, whereas with time the testosterone levels tend to start to decline. And that's why with men, a lot of men come in, looking to replace their testosterone levels, and then females will come in looking to replace both testosterone and estrogen, which brings us to another point I wanted to mention, and that's we always do tend to think of testosterone as a male hormone and estrogen as a female hormone, and they kind of are, but we both have both hormones, both sexes have both hormones. It's just that males have a lot more testosterone than females, as we might all be aware, but females have, a significant amount of testosterone in their system, and when the testosterone levels drop in females, that's also associated with a lot of symptoms. And a lot of times when we replace the testosterone, whether we're replacing it along with the estrogen or even without doing the estrogen at the same time, we see a lot of improvement in many of the symptoms that are associated with that decrease in levels. It's a long answer, but kind of went over a little bit of everything about hormone replacement therapy. But we'll go to the next question.
So there's one question. My sex drive is low. Could it be my hormones?
For sure. So the question is, if sex drive is low, can that be related for hormones? And definitely, a low testosterone level can definitely bring down not just the sex drive. It can definitely bring down the sex drive, but also sexual function in general. So it can present as low libido. Can also, present as in males, erectile dysfunction, which can be to varying degrees, but definitely one of them, along with like the low energy and all the other stuff that we've talked about. But sex drive is one of the main things that we do see go down. And a lot of times people think that it's just an age thing, but it doesn't have to be. It's more often related to the hormone, certain hormone levels going down, and then you replace that, the libido can increase, but also the sexual function in general for both males and females can increase. Low testosterone is sometimes associated with vaginal dryness, and that can be associated with pain with vaginal intercourse and a lot of other symptoms. So that can, and then with males, obviously there's the varying degrees of ED as we mentioned. So definitely can be symptoms of hormone deficiencies.
Okay, so there's another question. What are the benefits of bioidentical hormone replacement therapy, and how quickly does it work?
So what are the benefits and how quickly does it work? I think we've already kind of talked a little bit about the benefits because we were talking about all these symptoms of hormone deficiency, and the benefits is minimizing and reversing these symptoms. So all the symptoms that we've talked about, whether it's the insomnia, sleep issues, whether it's the low sex drive, low libido, the ED, whether it's like people gain weight more easy or easier, I should say, when their testosterone levels are low and it's harder to put on muscles. So all of these signs and symptoms of hormone deficiencies can be minimized and reversed by replacing hormones when they're due to hormone replacement deficiency. So in other words, better sleep, better sex drive, better sexual function. And for women with replacing estrogen, we often see less night sweats, hot flashes. All these stuff can decrease if the hormone is replaced. So that's the benefits. And there's a couple ways to replace hormones. How often you see benefits will depend on which what method we're using. But usually, if I know a lot of people are interested in pellets. So with pellet therapy, the good thing about pellet therapy is that it can last, anywhere from 3.5, 4 to 6 months, depending on who we're doing and what we're doing. So you just kind of do the treatment and then you're good for the next 4, 5, 6 months. Usually with pellets you see results. We always say give it up to 2 weeks. Most people will start seeing improvement way before the 2 weeks, within a few days. But it can take, if it's your first time doing it can take up to 2 weeks from doing the pellets before you it fully kicks in.
Okay, so will I need blood tests?
Do you need a blood test? Yes. We always get a blood test before hormone replacement therapy. It's a combination of the symptoms that someone's experiencing and the blood levels. So we don't do it based on either alone. If someone, we can't just do it based on the symptoms. We have to also get the blood test because there are other things that might cause similar symptoms. If someone's thyroid might be off. And you also don't do it based on the blood test alone. The person will also have to have symptoms that are associated with the blood test. So yes, it's a combination of both. We usually, like the way we do it here and the way a lot of places do it, but the way we do it here at least, that we have the patient come in for a consultation. We have kind of a checklist of some symptoms, and then we sit down with the patient, we take our time, we talk about hormone replacement therapy in general, we go through the symptoms, the benefits, risks, alternatives, all that stuff, and then we order the blood work, and then once we get the blood results, we kind of talk to the patient again, comparing the blood test results, the symptoms, and see if there's a match there, and if there is, then we can be like, okay, that person would be a good candidate for hormone replacement therapy, because we do expect like significant improvement. If we can correct these levels, we'll probably see an improvement in these symptoms over here. So yes, blood tests are required.
And is fasting required before an insertion?
No, fasting is not required before an insertion. Usually not before blood tests either, unless you want to check the cholesterol too. There's some evidence that some hormone replacement therapy can help improve cholesterol levels, which is a bonus. But usually, if we're not worried about the cholesterol, then the patient doesn't have to be fasting.
Okay, and somebody asked, what happens during the in-office insertion?
So I think we're talking about pellets again, and what happens during the office insertion. So it's the insertion is honestly pretty simple. We do it under local anesthesia, meaning we just numb the area with lidocaine, just like 3 mL of lidocaine or something. So you just initially feel the needle poke. So with the insertion, basically we're inserting the pellets in the subcutaneous tissue. We're inserting the pellets underneath the skin. And these are the small size pellets that are going to be producing the testosterone and estrogen over time. So we make an incision, usually kind of in the upper buttocks area, a very small incision. We often don't even need to suture it. We just put a steady strip on top when we finish, and then we put the pellets through underneath the skin where we want them to be, and we put a steady strip on top, and then the client's good to go. So it takes like 10-15 minutes. Most people don't feel anything. You just feel the initial needle poke when we numb you for a quick second, and then the area gets a little bit numb, and then we do the procedure, and then you're out. And like I said, within 10-15 minutes, and then you're good for the next 4 or 5 months.
Okay, and another one. What happens to pellets after insertion or any downtime?
There's not much in downtime. We put a sturdy strip, so these kind of scab over and fall off on their own within 5-6 days usually. I would just ask you not to use the area excessively. You don't want to stretch it too much, so you don't want to go home and just because there's a tiny incision, so you don't want to go home and do tons of squats or do tons of like extreme yoga where you're super stretching the area. Just not to you want to give your skin time to heal, so you just want to avoid certain activities for a few days. You don't want to soak the area in a bathtub or a hot tub or swimming pool for a few days. But you can shower, you can do everything else pretty much as usual. People will come in on their lunch break, get it done, and then get back to work. So there's really no downtime in that regard. And what happened to the pellets? The pellets dissolve on their own. They're fully dissolvable. So we put them in, and then they dissolve in a few months, 4, 5, 6 months, while they're providing, and as they're dissolving over that time, they're producing that testosterone, which is, given the body the testosterone it needs or the estrogen it needs, depending on which one we put in. I think this is all the time we have for today. Thank you guys for joining us. We hope you find this a little bit educational, and if you have any more specific questions, or if you want kind of a more personalized consultation, you can always call us or send us a DM, and we'd be more than happy to answer any specific questions for you. Thank you. Have a good night. Have a nice weekend, and we'll see you next Friday.